First question from the audience. Dr. Peddle, I'm a 47-year-old, and for the last 6 months, my periods have been coming every 3 weeks or so. Aren't my cycles supposed to get longer, not shorter? Is there anything natural I can take?
Yeah, the question is, a woman has irregular periods. Remember I told you that irregularity is produced by loss of progesterone, so Vitex is a natural thing you can use if you can't get progesterone. A supplementation, herbal supplementation, like hormonal balance, very nice, because what happens is, as your hormones begin to alter, you have physical symptoms. Physical symptoms come from an imbalance in your hormones. Listening to the hormones, the doctor can tell which hormone is low. He can also check it. But by balancing, what we do with balancing hormones, if you can't get to a hormonal doctor, what you do is you're trying to remove estrogen, because estrogen dominance is the issue. Estrogen dominance is usually causing the lining. Remember I told you the lining gets thick? Well, picture the lining getting thick from estrogen, and progesterone is supposed to come along and hold it. Well, it can't hold it, it's too weak, estrogen is too strong. Early periods, so periods every 3 weeks are perimenopause. So for 5 to 10 years, by the way, for the next 20 years, every 10 seconds a woman's going into menopause. Physician, prepare thyself.
Wow, okay, and the natural recommendation?
Natural hormonal balance, you can get
Natural
Vitex, you can get, depends on the but Vitex, natural hormonal balance, decreases estrogen, probably puts the periods back normal. If you can't get normalized, blood tests around 18 to 22 days before 10 o'clock in the morning, see what your progesterone is. If it's low, check maybe with a progesterone cream.
Awesome stuff. Otherwise known as chasteberry.
Vitex acts like progesterone.
Vitex.
Yeah.
Wonderful.
Yeah.
Next question, Sherry. That's a question for you. I'm taking Lipitor for my cholesterol, and I read that people should take coenzyme Q10 with this. What are your thoughts?
That's right. And that is really important. If you are taking a statin drug, such as Lipitor, Zocor, Mevacor, the statin drugs, part of how they work to lower cholesterol is they go through this pathway that also reduces levels of coenzyme Q10, which is also known as ubiquinone. So classic symptom when people are on a statin drug is they often get side effects of sore muscles, weak muscles. It can actually, in some cases, be very serious and cause what we call myopathies or rhabdomyolysis. So by supplementing with coenzyme Q10, if you're on a statin drug, it helps to prevent that depletion, reduce the risk of that side effect, which is the muscle weakness. Plus, coenzyme Q10 is just so important for heart health. So I would look for coenzyme Q10 and take it along with your fish oils, your omega-3 fatty acids.
Excellent. That's wonderful. Everyone get that? Coenzyme Q10 if you're on a statin, cholesterol-lowering medication, key. Question for Kelly. I'm one of the only 5 guys in here. I'm also moderator of this event this evening, wondering if it's abnormal that I'm just kidding, never gonna go. So, real question, how do I go about choosing my first vibrator? I'm really shy, and I find the whole idea kind of embarrassing.
Okay.
You guys are an open crowd, let me tell you.
Here we go. I brought toys. I brought props, just in case. So, vibrators used to look like this. Pretty intimidating. If you have a male partner, they probably don't like it if you bring home something like this. They're thinking, what's wrong with mine? Why do you need that one? Now, you can get vibrators that look a whole lot less intimidating. Like this guy. This rubber ducky. Feel that. Pass that around.
Anyone here read the book Slow Death by Rubber Duck? This is like Slow Orgasm by Rubber Duck.
Rubber duck in the tub.
Yeah.
In the tub.
In the tub,
It's
yeah.
actually waterproof.
Yeah.
You can put it in the tub. The kids see it. They don't go, Mom, what the heck is this? It's just a rubber ducky. And it feels good on their backs and on their bones and whatever.
It's one thing for Ernie and Bert to get married, okay? But it's another thing, like the whole bath time turns into a whole other thing with rubber ducky involved.
Lipstick. A lipstick vibrator. Doesn't look all that unusual. You're going over the border. It's in your makeup case. No problem with that. Okay, and you no longer need to go into a sex shop to get a little vibrator. You can go into your local Rexall, your local pharmacy, and you can pick up one of these doodads. It's made by Trojan. It's vibrating touch, and you just turn it on. It goes on your finger, and you can do whatever you like with it. Your partner can as well. And they're about $10, so that's a nice way to try out a vibrator or a sex toy. You don't have to spend a lot of money. Here you go.
Or
I
if
don't
your
want these
budget's
back,
really worn
by the
thin
way.
and you're still driving a 70s Ford, you know, you could always just go turn it on and sit on the hood. Am I right?
Okay, what else do we have? Here's another one you can buy at the Rexall. This one's made by Durex. These are a one-time use, by the way. Remember I did I did this. Wasn't doing a whole lot for most women. This is a little ring that goes around the penis. So you're doing your thing, and at some point you just slip this on the base of the penis, press this little button, and now, well, hopefully he'll be able to fill it out a little more.
What is this?
Here. If this is the clitoris,
Dr. Petal
you
is
got
never
this
too late, my
right
friend.
up against the
Ruth,
clitoris.
you're in for it. Where are you?
So this, what do you got, your grandchildren?
I said Ruth. I meant Carol, by the way.
So this is providing pleasure to both partners, right? It's around the penis.
Can't contain himself.
Do you want it? Here.
Oh, no, no, no.
Here. You can play with it. Yeah, take it. Okay. Oh, here.
I've never seen one of those before.
This one I love only because of the way you recharge it. You don't have to use batteries with this. You just stick it in your computer. You press the button and it vibrates, and it has all kinds of little, has a pulsing thing, I don't know, whatever. It's a good one.
Who knew vibrators were the solution to all our woes? And now I know why they left a little fan up here for me.
Okay, now
All right.
this has oh, hold on, I like this one first. A bunny. So you press this little button. Actually, you're probably best to take this twist tie off so you have more room to play, but whatever. So you press this button and the vibration goes up, and I don't know if you can see, but these little bunny ears do their thing. Here, Mom. That is my mom. When your mom starts asking you about sexual issues, it's still kind of gross, even if you're a sex therapist. Okay, this I really love. This is called the We-Vibe. It's really new, and actually a couple of other models have come out since this one. The way it works is the smaller end actually goes inside the vagina, and the other end stays out, and it is up against the clitoris. So it's kind of like a little clip that goes inside the vagina. And you can use it on your own. It vibrates in all different kinds of speeds. And you can also use it with a partner, which is why it's called the We-Vibe. It has a, what do you call it, a remote. So if it's used with lubrication, then you can have very pleasurable intercourse. The penis just, oh, I need my penis back.
Sherry's dad's wondering what it's called, by the way. I bet you it's called a clip clit. Clit clit. I bet. Is that what your question, right? How does it work?
He asked if the girls
Where does it
can
plug
wear
in?
it to, no, he wants to know if they can wear it to work.
Oh, wear it. Yeah. Now you're thinking. Now you're thinking.
I guess
We have,
so.
by the way, I just appreciating we have about 500
I know,
more.
okay. All right, so I just
not that
wanna
I
show-
want to hear nothing more
Okay.
about
I know,
vibrators.
No, I'm just gonna show. I just needed the penis. So it goes in like this, and the man gets a lot of pleasure, and so does the woman. So lots of sex toys out there. They don't look like this anymore. Some of them do, but most of them don't. I love a place called Good for Her. It's on Harvard Street, 175 Harvard Street at Bathurst and Harvard. And actually, on your way out, the first 100 of you that grab them will get a 15% off coupon at Good for Her. All their staff are sexual health educators, and they're great. And it's a women's focused sexuality store. So go there. Pass back my toys, please.
All right, a really, really, really fast joke. I just have to. It's got to take a lot of balls to do that. All right, Dr. Alvin Peddle. Can a woman have more density in one breast compared to the other? And just what causes breasts to be dense in the first place?
Well, the basic premise of dense breasts is the whole concept of thermography is new. Breasts don't develop cancer overnight. You get hot, cortisol, stressed, and as one breast gets hotter and hotter, there's lots of theories why one breast might be hotter than the other, right side being father, left side being mother, heart. But fibrous breasts are very difficult to see through in a mammography, so even if you give any hormones, it's difficult to see through mammography because it's thick. And some women have fibrocystic breasts. And so you cut down the amount of dairy, you have to cut down the amount of estrogen. So it's estrogen content, throw in genetics, throw in estrogen. And dense breasts don't necessarily mean you're going to get cancer at all. But remember I told you about the movement when you examine yourself? A fibrocystic will move. It'll be kind of like a moving little rubber duck. It'll kind of move around. It'll be like, not like that rubber duck. That rubber duck I want to take home with me. No. All kidding aside, a cancer mass doesn't happen overnight. It takes many, many years. And fibrocystic breasts do not mean you're destined to have breast cancer. But you should have a heads up about self-examination. You should have a heads up about the look of your breast, the size of your breast. And breasts do tend to be, you can palpate your own breast, and the doctors have to be very much aware of your consciousness. And then so fibrous thermography is a future thing where heat, if a woman puts her hands in cold water and she's standing in front of a temperature pickup, it basically, if there's a mass that has more blood going to it, well, why has this mass got more blood going to it? Maybe more interest than not. So.
And I heard you say checking yourself at menstruation
Yeah.
is really key. Different positions,
Yep.
possibly in the shower with some
Yep.
conditioner, so it's nice and slippery.
Yep.
But is it normal to have one breast more dense than another?
Yeah, sure. It can be.
That's
It
okay.
can be very normal because
All right.
one breast is usually bigger than the matter of fact, I got to talk to you later because one side's bigger.
Why is one of my breasts bigger than the other?
Yeah.
See, he's that good of a doctor. He can, with my shirt on, even touching only one, he knows one's bigger than the other. A question for Kelly. This is absolutely non-vibrator related. So
Okay.
I'm in my late 30s and I've never had an orgasm. I was kidding. It probably is. Is there any hope that it can still happen? Late 30s.
Yes, absolutely. And that's not all that uncommon, actually. And we call it pre-orgasmia, which means haven't had one yet. And there are many programs and books out there to help women to learn to have their first orgasm. I think I did speak in my presentation about the importance of self-pleasuring or masturbation so that you can get to know what feels good sexually for you. Because I think many women wait until they're with a partner and are hoping to figure out how to have an orgasm with a partner. But as I said, it's very hard for the partner to know what feels good for you. What feels good for you feels different for Jane, feels different for Sharon, feels different for Linda. So you need to get to know yourself what feels good. There are lots of books out there, and actually I brought some. Betty Dodson has a book called Sex for One, an excellent, excellent resource. Some of you might have actually heard of Betty Dodson. She's been in the sex biz for years. Lonnie Barback has some really good books for yourself. It's called For Yourself, The Fulfillment of Female Sexuality. And this one here is one of my favorites. This is an old one. It doesn't look like this anymore, but it's called Becoming Orgasmic, a Sexual Growth Program for Women. It's by Julia Hyman. Interesting. Leslie Julia Hyman, I'm not joking. Piccolo and Lo Piccolo, their husband and wife team.
Size doesn't matter.
Those are some really good books. So just because you haven't had one doesn't mean that you won't. You might just need to do some practice and learn how.
Excellent. We have 15 more minutes before what my producers call a hard out. That means the lights go out and the cameras go off. So I'm going to try this as fast as we can. I'm going to hit you guys up with questions, and we'll try doing this as a real fast answer here. So even though, this is for Dr. Alvin Peddle, even though my eating habits have not changed, I've gained weight recently and can't seem to take it off. Is this linked to menopause?
Yes, hormones can cause, estrogen makes fat. Fat makes estrogen because it's kind of a dynamics. Low thyroid makes fat, but hormones are made from fat. So if a person is getting a little older and can't produce progesterone, they can get fatter, yes.
And you're only one guy, so where can people get access to
Well, the
your
good
content?
news is 10 physicians came to my last lecture. 10 physicians. Not in 20 years have I seen 10 physicians. So they're beginning to pay attention.
They're
because-
learning.
Yeah, they're beginning to say, you know what, my patients keep telling me this. It's not going away. This is for real. Yeah.
Excellent.
What's that? We'll give you names, yep.
I'll tell you what, folks, just to remind you as well that if your question doesn't get answered this evening, FemMed, I believe, is going to be posting this on their website with full answers to all of your questions. So fear not, all of these cards in my hand will get answered this evening. Question for you, Sherry. I recently read that salt may not be as bad as once thought. I have normal blood pressure, so do I need to cut down on my salt intake?
Yeah, that is a recent controversy. It was once thought that everybody that has high blood pressure should be cutting down and eliminating salt because we get salt not just naturally occurring in our foods, but we add salt in condiments and shakers and et cetera. But the current thinking is that salt may not be as bad as we used to think. Unless you have a salt sensitivity with your hypertension, you probably don't need to do any extreme cutting out of salt in your diet. Of course, a lot of foods that are naturally high in salt, like processed foods, I would avoid and eliminate those. But moderation is the key.
And then if you do have the sensitivity, you've spoken to your doctor, it's the NASH diet, correct?
That's the DASH diet.
DASH diet, rather, DASH.
Yeah,
Excellent.
the dietary approach to stop hypertension, keeping it below 1,500 milligrams a day.
Perfect. Kelly, is it weird or abnormal to fantasize during sex?
Is it weird or abnormal to fantasize
Come on, you
during
guys were
sex?
listening. True or false? Is it weird
True or
to
false?
fantasize?
I'm gonna throw it
False.
at you. No, it's not abnormal.
I'm seriously
Most
educating
of
my
us
wife.
do, and it's totally normal and it's totally healthy. And remember, I was talking about how hard it is for us to get into a sexual frame of mind when we're so busy and so stressed. So fantasizing can help us to do that. And actually, there are lots of books on sexual fantasies. I think I have a couple. Nancy Friday. Anybody read Nancy Friday books? Women on Top, Men on Top. This was her first, I think, My Secret Garden. She has women who actually write in and send in their own fantasies, and this is a book, all of fantasies. Lots of books on erotica. So it's normal, it's healthy, it's fun, and don't.
But not about rubber duckies.
Well, listen, if it works for you. Thank you.
Awesome. All right, so guys, we have two more draws. We'll get right back to questions in a second. This one is the gift basket courtesy of Lululemon. I love your Lululemon. I'll do this one to make it quick. Get your numbers out ready. Shake it up. All right. The fourth and fifth prize going out this evening for our Lululemon, prize valued at whatever it is, but it's amazing. 529470. 529470. Yay, right up there. Do you mind, the lady in the black there? That's awesome. Thank you so much. I'd like to take a quick opportunity before getting to some final questions here to thank all of our sponsors this evening. It's been incredible, and obviously our panelists. Let's give them a round of applause right now, folks. Dr. Alvin Peddle, Kelly Young, Sherry Torkos. Incredible. I want to thank FemMed, obviously, as well. A very special thank you to them. And as well, you, the audience, give yourselves a round of applause. Share this wonderful information, folks. I don't know how to get this slide up here. Oh, there we go. Excellent. So I also want to, this is our sponsors. I want to thank them again. I want to mention that there's a 48-hour offer by FemMed right now that you can buy one and get one free. And, of course, get free shipping, by the way, of their products at femmed.com. Take advantage of this. And they'll be sending you an email And you know, these days there's a lot of spam blockers out there, especially for these kinds of things. You know, your computers might be reading these things, saving them as cookies. Just make sure to check your junk mail because you don't want to miss an opportunity for this really wonderful offer. So just to reiterate that, it's a 48-hour offer, buy one, get one free, and free shipping. So look out for that email. Last prize, and we'll get to some final questions. This prize is totally loaded. This is incredible, okay? Anyone who left, it's unfortunate, but those who remain, I'll keep choosing tickets until there's a winner, is a loaded tablet, loaded with health, all kinds of health information. It's all kinds of information for women, all right, by FemMed. So I'm going to get to that ticket right now. Shauna Page, CEO of FemMed. Let's give her an incredible round of applause for putting this together. Amazing. And, you know, in particular, remembering and appreciating that all proceeds are going to Breast Cancer Awareness Foundations. Wonderful stuff. Thank you. All right. This is the lucky 333-529-333. Yay! Woo! And she stuck around. Good. Okay, while that prize is delivered, Dr. Peddle, and we got to get out of here in 10 minutes, so we can get some more answers in here. I did not have a period for 11 months. Then I had a period. So I didn't for 11, then I did one period. Does this mean that I have to wait another 12 months to be sure that it's menopause?
Well, menopause is defined by 12 months without a period, but individuality is very important. A person can have menopausal symptoms 3 months into menopause. You see their FSH, their follicular stimulating hormone, is very high. They have no estrogen, no lubrication. You're starting to look at a person that is probably menopausal, but 50% likelihood of being menopausal. So you don't have to be 12 months, but the classical SOGC says 12 months you're menopause, then you can have estrogen. That's not really true. You're really menopausal when you feel the symptoms of menopause and your hormones are associated.
So it's really about symptoms. You want to talk it over with your doctor. Stick around for 5 more minutes, folks. We're not going to be that much longer. Some really good questions are coming out of this. And it's kind of like pushing the reset button after 11 months, but the individuality is necessary. Okay. Sherry, this is a common question I get from all my viewers. How much fish oil? How much fish oil should women take for heart health?
Yeah, well, it is a bit individual. I tend to recommend at least 1,000 milligrams daily as part of the maintenance program. Now, if somebody has high triglycerides, we tend to go with much higher dosages. So if you're taking fish oil for a primary reason of lowering your triglycerides, we would go 3 grams, 4 grams a day typically. The only issue is we have to watch sometimes at higher dosages. With fish oil, it can lower your triglycerides, but it may have a slight effect on increasing your LDL. So we do tend to tailor that towards the patient, so it's based on your individual situation.
Excellent. Kelly, since my period stopped, and this woman is in menopause, her vagina has become very dry and intercourse is painful. You talked a little bit about this in your presentation. What can she do about it beyond my little quip about, not really quip, but true, about aloe vera?
That's actually true, and actually almond oil is a really nice lubricant as well. So there are some natural lubricants you can try. One of my favorite lubricants, I actually have it over there, and I showed it on the slide. It's called Pure, but it's spelled P-J-U-R. It's right over there, yeah. That's one of my favorite lubricants. It has silicone in it, and so it's... It stays really slippery. It doesn't get that tackiness that you can get with some oils and some of the other water-based lubricants. It's one of my favorites.
Excellent. Dr. Peddle, back to you. What's your view regarding mammograms and ultrasound for early breast cancer detection? And you did talk about thermography, but your views on those?
Very controversial, and it would take a whole hour just talking about mammograms themselves. I think they're overdone. I think you do too many of them to find the one, but the one is very important, of course. But I think the standardization of everybody, you got to look at that again. So I think higher risk, yeah, sure. But you got sister, God forbid, mother, whatever. Yes, very high risk. But people are low risk, and people are taking care of their health, squeezing and radiation and every year. I'm not so sure you and I would want to have this done on our...
Too much radiation causes free radical load, causes cancer. But ultrasounds, to be clear, ultrasounds are non...
Ultrasound, I'm a big fan of because ultrasound picks up liquid. It looks black. So if you see a mass that's moving around and you think it's cystic, yeah, do an ultrasound. There's no big damage. But if it's a solid mass, it could be missed with an ultrasound. So history, physical examination, ultrasound, thermogram, mammogram depends on the individuality.
Individuality.
Of the connection. Once again, it's a decision made uniquely to that person.
And by the way, mammograms nor thermograms or thermographies are diagnostic. That might come to a surprise to a lot of you. They're non-diagnostic. Dr. Alvin Peddle would agree with me. The biopsy is the diagnosis once you aspirate and do cell culture histology, but neither of them are diagnostic. Okay, so keep that in mind. You heard it from him just now that they should be reconsidering how often the frequency, regardless of risk. And it's interesting, science is paying attention to this. Researchers are, however, they are looking at volatile organic compounds, VOCs, or what women would produce on breath, correlated to free radical load in the system, correlated to breast cancer risk. Really neat stuff coming down the pipe soon. Anyways, very non-invasive, no squeeze. Sherry, my husband takes an aspirin a day, which was recommended by our doctor to prevent heart attacks. I'm a healthy person and don't have a family history of heart disease. Should I also take a daily aspirin? I'm personally in favor of an 81 milligram baby aspirin. What's your take?
Right. Well, the recent guidelines, though, suggest that it's based on age. For women below 65 that have not had a heart attack or stroke, the guidelines are different for men versus women. For men, we recommend a daily aspirin a day. But for women, what they've found is that sometimes the risks of bleeding, hemorrhaging, of course, the main side effect with aspirin is the risk of hemorrhage. Sometimes those risks outweigh the benefits, so we no longer recommend every woman take an aspirin for heart protection. It depends on her age and her risk factors.
Excellent, thanks so much. For Dr. Peddle, why am I still having hot flashes and night sweats at age 67?
Well, I get a phone call from a patient on Monday morning who's been on my hormones for 3 years, and they said, Dr. Peddle, you got to give me more hormones. I'm having flushes. I said, what happened on the weekend? Well, my daughter came home. She's pregnant, and she's not getting married. I got a flush just listening to the story. So flush can come from cortisol, from stress, and so now I start saying, well, wait a minute. I can't give you. Less is more. Really, in farm, less is more. So as you get older and you're supposed to get wiser, less is more. So you got to kind of back up and say, well, let's look at the situation, whether some things we can change, some things we can't change.
Excellent. Who wrote the question, if they don't mind answering or holding their hand up, about the primal or paleo diet? Okay, wonderful. Do you want my, because it wasn't specific, anyone's. Okay, perfect, thank you. So if you're familiar with the primal diet or paleo diet, can you speak to your thoughts and risks or benefits of following it in terms of women's health? You know what, let's start with you, Sherry. That's very cardiovascularly related.
Yeah.
This is like the anti-vegetarian. This is mainly meat, no grains, by the way, the phytic acid and vegetables and tubers. Paleo, primal,
yeah.
like eat like ancestor, eat like caveman, eat like what biology was designed for.
I got it.
Yeah, okay.
Nicholas Gonzalez, Nicholas Gonzalez talks about this. Eskimos eat blubber, they hide fish, that's their diet, and that's their healthy diet. Doesn't mean you have to eat that way, but if you're genetically predisposed, that's what your diet should be. It's calm, it's relaxed, it's peaceful. The thing really is like the Rosetta effect. Be surrounded by love, good karma, and all of this kind of just settles down, and it's all individual. I'm telling you, it's totally different.
Goes back to
It's
genetic
genetics,
predisposition,
and
for sure.
Nicholas Gonzalez is right.
Their argument is that that's the way that people have been eating over millions
right.
and millions of years, hundreds of millions of years. And if you take it, we are overeating grains. We're way overeating grains these days. It's a lot of phytic acid, which, by the way, binds iron and can also bind calcium as well. So the consideration is that we might be more gluten intolerant as a global society. We're certainly, way overeating refined carbohydrates. And it doesn't say no carbohydrates. It just sort of takes you away from the tubers and the refined grains and so forth. So I think there's some validity to it, but absolutely, go ahead.
I was just going to say, I would add to that, though, there is a lot of evidence suggesting that a vegetarian diet, which is
it's a China study.
Getting your protein sources primarily through beans and legumes and whatnot, is correlated with lower risks of heart disease and cancer and a lot of other things. So I don't feel that all meat is bad. However, the problem today is our meat is so different than it was thousands of years ago.
Absolutely.
The meat today
Very good
is
point.
Animals wear discs in their ears where they're infused hormones, and they're sprayed with pesticides to keep bugs away. So the meat today is so different than it was
very
thousands
good
of years
point.
ago.
Absolutely. Last question. The recommendation is 7 hours of sex per night. Is that continuous, unbroken, or also interrupted? Kelly? Oh, wait, no, wait, sleep. Sorry, sleep. 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 7 or more, as much as you can get, everyone. Thank you so much for coming out tonight. And let's, once again, thank you so much to FemMed and all of our presenting sponsors. Have a great evening, ladies.